In a 5-minute to 15-minute consultation with a doctor, a psychiatrist generally, or someone in the mental health field, a checklist is filled off. You answer some questions about, do you feel sad? Have you been feeling sad for long, or whatever? And in that checklist, you get given a diagnosis and a label and a medication. Nothing about your story, nothing about what you're going through. Maybe you were just have lost a loved one, so you're obviously depressed, because depression's not a disease. Depression is an experience of the mind in response to bipolar depression, general anxiety disorder, schizophrenia, all these very scary names. They are not diseases. They have no scientific foundation. They are not chemical imbalances. The public has been played by the pharmaceutical industry and by the psychiatric industry to control people's minds. You take away people's ability, and you get to actually, and this will get you, you take away people's ability to tell their story, to express their emotion, and then to deal and reconceptualize. If you take that away from them, you dehumanize them. If you instead say, okay, you are a disease-broken individual, ignore that. Let me give you a brain-disabling drug. That's what antidepressants, antipsychotics, anti-anxiety medications, and stimulants like Ritalin do. They are brain-disabling. They literally disconnect the spirit of man from the physical body, because they numb the brain like an anesthetic. And not only do they numb the brain, they damage the brain. So over time, you get cognitive decline. Your brain starts getting damaged. So you land up on disability because you can't function. Your chances of suicide increase. They are putting your chance of aggression. The average psychotropic medication, which is all those I've just defined, they have an average of 1,800 to 3,000 side effects, and every single one of them is negative. There is nothing positive about them. The only reason people feel that they work is because they numb the pain for a season. But they cause damage in the brain, the pain comes back, so a negative cycle starts coming up, and then people get put on multiple drugs. It's called polypharmacy.